Yes, good morning. Hello and welcome for a webinar on anatomy of ear. In anatomy of ear, middle ear is significant for your examination and as well as it is a significant for your clinical scope in future. But sometimes questions are also posed on internal ear. Sometimes question is also asked on eardrum. And sometimes a short note is also asked on ear ossicles, which comes in the middle ear. So mostly if you know the middle ear, the anatomy of ear is almost 80% complete. Let us try to understand the full anatomy of ear within a span of 30 minutes because this is a revision. I have already discussed this topic at length during our regular classes. Here you can see the outline of ear, what we call major divisions of the ear. Ear is divided into two mechanisms as far as its functions are concerned. Okay, peripheral mechanism and central mechanism. So central mechanism is lying with the brain. Brain has got cerebrum, and cerebrum has got cerebral hemispheres, and cerebral hemispheres has got four functional lobes, and one of them is temporal lobe, and temporal lobe has got areas for hearing. You know those areas 41, 42, 20, 21, 22. So that is why central mechanism is always with the brain, because brain is the part of the whole body which is required to coordinate and control the whole body. So coordination of ear and control of ear is done by the brain, where you can hear the sound and when you can interpret the meaning of the sound. So central mechanism you just keep aside, it is with the brain. We have to study peripheral mechanism as far as anatomy of ear is concerned. So ear is basically divided into three parts: external ear, middle ear, and internal ear. But sometimes fourth part which lies between the ear and the brain is the nerve connecting ear to the brain. So nerve which is carrying the hearing sensation to the brain, it is the eighth cranial nerve, and the name of the eighth cranial nerve is vestibulocochlear nerve, and that cochlear part is required for the hearing. So it is having two functions, vestibular and cochlear. So that is why peripheral mechanism becomes in four parts: external ear, middle ear, internal ear, and auditory nerve. But more than auditory nerve, its anatomical name is vestibulocochlear nerve. We always say vestibulocochlear nerve. So this is what we are going to study today in follow through slides. Here you can see a diagram, full diagram of ear. Okay. Here you can see all three major parts of the ear, peripheral mechanism, what we call. The outer one is a very big portion up to the eardrum. Eardrum is located. See the cursor of my mouse, okay, where I'm giving you arrow. So this is the eardrum. From here onwards is all is the external ear, which includes the ear pinna and external auditory meatus up to the eardrum. So here the external ear ends, and external ear is also called as outer ear, and it is also called as oris externa. Oris means ear, externa means external. That is in Latin. And it has got a auricle or auricula. This is called as auricula or auricle. And it has got a meatus acousticus externus. So that is in Latin. So you can call it as external acoustic meatus in your own language. Mostly you make it in English. And here, then there is a small, what you call, internal ear. Though it is very important and significant, it is very small space. And middle ear is also called as oris media or middle ear. Okay, and it has got a tympanic cavity or cavitas tympani. It has got a membrana tympanica or tympanic membrane. So tympanic membrane means eardrum. Eardrum is also called as myringa. So it has got many names, and it is a partition between external ear and internal ear. And inside the middle ear, there are auditors. Auditors means auditory ossicles or ear ossicles. And there is a tuba auditiva. Auditiva means auditory tube. So auditory tube is which is going from the middle ear. See this downwards and inwards in the nasopharynx. So auditory tube is connecting the middle ear to the nasopharynx, and it is also called as Eustachian tube. Eustachian tube because it was discovered by Eustachius from Greek, and this connects the middle ear to the nasopharynx, then nose and exterior. That means air which is coming and causing pressure on this tympanic membrane from outside is controlled by air from nose through middle ear inside. So in the middle ear, air goes from the nose, and in the external ear, air goes from external auditory meatus. So there is air present in the external ear and there is air present in the middle ear, but there is no air present in the internal ear. So remember this. Now inner ear is also called as internal ear. It is also called as oris interna or inner ear. 2, 2, 3, 3, 4, 4 names you can use in different languages. Anatomy, most of the time if you use Latin words, that is well and good because that is a basic language of anatomy. And this internal ear contains labyrinthus membranaceus, or labyrinthus membranaceus and labyrinthus osseous. These are these two names, or they also contain labyrinth and they contain cochlea, okay, and semicircular canals. Different names we have for all those. So out of this, middle ear is very important for the purpose of your exams, because mostly exam questions are asked on this. I told you that. And plus otitis media is a applied anatomy of middle ear. That means कान फुटणे सुजणे वगैरे. Otitis media means inflammation of the ear and inflammation of the middle ear. And otitis interna means inflammation of the internal ear. That is very rare because it is close to the brain. But mostly the middle ear gets affected because it has got exposure from the nose. That is why. And examination papers, if you see, the questions are mostly on the middle ear. So do middle ear properly. Along with that, you do study of eardrum and ossicles. And if at all you want to go to the more depth, then you study internal ear also, because cochlea is very important. Well, external ear or outer ear, we'll try to understand through this slide. It has got a pinna, P-I-L-L, pinna. Pinna means the part of the ear which we can hold in a hand. It is also called as auricle. And from pinna, there is a pipe or there is a canal which is called as external auditory meatus. It is longer. It is what do you call long, quite long. It's just not like a canal, I think. So you got a pinna, then you got a peri-auricular tags, then peri-auricular pits, okay, external auditory meatus, and cerumen. Cerumen means it is a wax-like secretion which is secreted by ceruminous glands which are present in the external ear. If you put your finger inside your ear, you can feel oily, sticky substance, and that is required for natural protection of your ears. त्याला वॅक्स म्हणतो आपण. त्या कानात काहीतरी किडे बिडे शिरले किंवा धूळ शिरली तर ते वॅक्सला चिकटून बसतात, आणि म्हणून ते कानामध्ये असावं. दॅट इज कॉल्ड ॲज वॅक्स इन कॉमन लँग्वेज. And function of external ear is for resonance. External auditory meatus, it adds resonance to it because it is a funnel shape. And as compared to other lower animals, human beings have got a small external ear. If you see other animals, for example, our friend donkey has got a huge external ear. It does like this, like this. Even elephant, such a big external ear they have. So that is for the purpose of collection of the sound and bring it to the ear. But human beings are having a small external ear, I mean ear, that is auricle pinna, but can hear anything from long distance. KK, कोण KK? Oppo, तुझा फोन बंद ठेव. Function of outer ear. Now we can see the function of outer ear. Don't look at these diagrams. Those diagrams are quite, fancied. That is called as piercing of ear. So piercing of ear is not a function. That is a joke. कानाचं वाटोळ लावून घेतलेलं बघा या दोघांनी. Okay, but anatomically and physiologically, if you think, this ear pinna part of outer ear helps you in collection of sound, and it also helps in localization of the sound, and plus it adds resonance to the sound, plus it protects the ear, because see the anatomy and the size and shape of this part, and plus it is sensitive, that is ear lobe are sensitive, and the sensitive is utilized for people for the purpose of sexual courtship and all that. So they are also useful. Okay, and sometimes these things are also used for punishment by some people, like you have to hold your ear and you have to do all that chow mau and all that stuff. Now ear pinna, visible portion that is commonly referred to as the ear. Okay, here I'm showing you here in this picture. It helps to localize the sound sources, and ear pinna creates distinctive imprints on the acoustic wave traveling to the auditory canal. If a person is speaking from right side of the ear, the right side will catch the sound faster than the left ear. You can see in this picture. Okay, longer distance is taken to travel. So ज्या बाजूने बोललं जातं त्या बाजूने कानाला लवकर ऐकू येते, because it is distance. Simple physics. Now external auditory meatus means these all pipeline up to the, or you can say the canal up to the eardrum. It's quite long as compared to other parts. नुसता meatus म्हणजे होल नाही आहे, तो लेंदी आहे. Extends from pinna to the tympanic membrane. Tympanic membrane means eardrum, and is about 26 millimeter in length, म्हणजे 2.6 centimeter. Okay, and 7 millimeter in diameter in adult ear. Size and shape vary from individuals, and it protects the eardrum. Nobody can reach the eardrum so easily. You have to put something longer inside your ear. आरामात eardrumला इजा होऊ शकत नाही because of lengthy external auditory meatus, and it is a resonator because it provides about 10 decibels of gain to the eardrum at around 3,300 hertz. Okay, so this is actually important for your hearing. The net effect of the head pinna ear canal is that sounds in the 2000 to 4000 hertz region are amplified by 10 to 15 decibels. So amplification is done by the external ear. They are plus sensitivity to sounds greatest in the frequency region, and noises in this region range are the most hazardous to hearing. So see, the noise which is hazardous to the hearing is also protected by this part of the ear. And elastic cartilage covered by the skin is its anatomical structure. So if the ear, if you fold it in front side, they will again back to their own side. So ear is having elastic cartilage. Nose is not having elastic cartilage. Nose is having fibrous cartilage. The external acoustic meatus has got fat glands, and we call them as ceruminous glands or glandulae ceruminosa, and plus they have got a hair follicles, because inside the ear also there are hair follicle up to the eardrum, because that is a part of skin. It is not a mucous membrane, it is a skin. So there are hair follicles, and these ceruminous glands, they are modified sweat glands, and they are present on the lateral wall of the canal, and they secrete cerumen, and the cerumen is also called as ear wax. It is a combination of wax and fats and fat glands which secrete and disquamated epithelial cells, and that is useful for the protection of your external ear. Now we'll go to the middle ear. Middle ear is a small box, and it resembles the matchbox. Matchbox म्हणजे काड्याची पेटी. त्याला जेवढे साइड असतात 6 sides. So this is also having 6 sides. So it contains a tympanic membrane. Actually, tympanic membrane is a partition between external ear and middle ear, but it is counted in the middle ear. Okay, and it has got a tympanic cavity inside, and the cavity contains the ear ossicles, or which is called the bones of the ear, and plus middle ear muscles, plus Eustachian tube going from middle ear to the nasopharynx, and plus mastoid process connection through mastoid ear cells, which is part of temporal bone. Now, what are the functions of middle ear in short? Because it is important for your physiology also. Main thing is conduction of sound. So conduct sound from the outer ear to the inner ear. That's simple. And second is protection. It creates a barrier that protects the middle ear and inner areas of the ear from foreign objects. So nothing can go beyond the tympanic membrane. And middle ear muscles may provide protection from loud sounds, which are not bearable. And plus it also works as a transducer of sound. That means it converts acoustic energy into mechanical energy. First is acoustic energy in the external ear, then it is converted into mechanical energy in the middle ear, and further it is converted into electrical energy in the internal ear. And brain wants everything in the electrical energy. Brain accepts everything that is coming through it through electrical energy. Okay. Plus it converts mechanical energy to hydraulic energy, and hydraulic energy is required in the internal ear because there is a fluid present in the internal ear. There is no air present in the internal ear. Plus, it is also working as an amplifier of the sound, amplification. Transformer action of the middle ear is amplification. Only about 1 as to 10, 1 as to 1000 of the acoustic energy in ear would be transmitted to the inner ear fluids. About 30 decibels hearing is lost. Here you can see the tympanic cavity. Tympanic cavity means middle ear. Okay. Now we understand middle ear is having, I told you, 6 walls, and in the 6th wall there is a space, and that space is called as tympanic cavity. Means again middle ear, and the volume of this space is 1.5 ml. Okay, and it is flat, and it is flattened form flattened drum eardrum. Structure of the tympanic cavity has 6 walls on 6 sides: lateral, medial, anterior, posterior, superior, inferior. It's easy to remember. Now we are in the tympanic cavity, and in the tympanic cavity you can see all these 3 air ossicles here. Okay, and you can see the spaces of mastoid ear cells on the mastoid process. Okay, yeah. Now lateral wall of the middle ear. Lateral wall means on lateral side what you will have, but naturally you will have eardrum. So eardrum is shown here. Lateral wall consists of eardrum, and eardrum is also called a tympanic membrane. The most important wall of the middle ear is tympanic membrane. It separates outer ear from the middle ear. It works as a barrier from foreign objects. Nothing can enter beyond tympanic membrane, and it is highly sensitive and painful also. It is cone shaped in appearance. It is not flat, it is conical shape. Okay, and it vibrates in response to the sound. When the sound waves touch the eardrum, it starts vibrating, and these vibrations are caught by the ear ossicles further. The membrane movement is incredibly small, as little as 1/1000th of a centimeter. That is in physics of uh, sound energy, acoustic energy. Tympanic membrane has got 2 parts: pars flaccida and pars tensa. Pars means part also, you can say part, but it is pars flaccida and pars tensa. Flaccid means loose, tensa means tense. So upper thin loose part is pars flaccida. Lower tense is pars tensa. 3 layers. The membrane is consisting of 3 layers. Eardrum is consisting of 3 layers. Outer cutaneous means skin. I told you on the external side there is a skin. Inner mucus. Now inside there is a mucous membrane, and in between there is a fibrous tissue. So skin, fibrous tissue, and mucous membrane. That makes 3-layered tympanic membrane. Okay. Now medial wall. Second wall is medial wall. In examination, you have to write all these 6 walls. So this is little bit in depth, but you take precise things which are essential for you to write the exams. Medial wall, pars labyrinthicus, most complex, and these are the structures: fenestra vestibuli, fenestra cochleae, promontorium, prominentia canalis, and prominentia canalis facialis. Superior wall is pars tegmentalis, separates tympanic membrane from the cranial cavity. Children less than 2 years, infections of the middle ear can pass to the cranial cavity through this wall. Superior wall is pars tegmentalis. Now, inferior wall is pars jugularis. Anterior wall is pars caroticus. Posterior wall is pars mastoideus. So, mastoideus means mastoid process of temporal bone. Anterior wall separates tympanic cavity from canalis caroticus. Inferior wall separates tympanic cavity from fossa jugularis. So these are the all 6 walls of the middle ear. And from middle ear, one tube is going to the nasopharynx, and that is called as auditory tube, or it is also called as Eustachian tube. It connects tympanic cavity with the pharynx. And which part of pharynx? Nasopharynx. Okay, 2 openings, one on middle ear and other on nasopharynx. 2 parts. Some part is bony and some part is cartilage. And function is to equalize the pressure on the both the sides of tympanic membrane for optimal hearing. So pressure from outside coming through the meatus and pressure from inside coming through this Eustachian tube. So this is equalizes the pressure on the both the sides of tympanic membrane. That is why Eustachian is produced from inside. This middle ear consists of aerocycles. There are 3 of them: malleus, incus, and stapes. It looks like malleus looks like hammer, incus looks like anvil, and stapes look like stirrup. Stapes is the smallest bone of the body. ह्या तिघांमधलं पण स्मॉल तेच आहे आणि पुऱ्या बॉडी मधलं पण स्मॉल तेच आहे. So stapes is the smallest bone in the body, and the muscle which is attached to the stapes is called as stapedius. The stapedius is another small muscle in the body. You can see the size and shape of all these aerocycles, and here you can see the smallest bone, that is called as stapes. It looks like a stirrup, stirrer which you used in the glass or in the cup. Now we go to the inner ear. Inner ear has got 2 parts, cochlear and vestibular. That is why the 8th cranial nerve is called as vestibulo-cochlear. It has got 2 components. Cochlear is for hearing and vestibular part is for the equilibrium of balance. The ear is also helping you to balance your body. Otherwise you will get vertigo, giddiness, चक्कर येते. So काना 8व्या नर्वची 2 कामं झाली. एक हिअरिंग म्हणजे ऐकण्यासाठी आणि दुसरं बॅलन्स सांभाळण्यासाठी. So inner ear is having 2 parts. So vestibular part contains semicircular canals, and it also contains utricule and saccule. Cochlear part is for traveling wave, and it's for conduction of sound further, where I told you the mechanical energy into hydraulic energy is converted into electrical energy, and which is further carried by the cochlear part of the vestibulo-cochlear nerve, that is the 8th cranial nerve. Now we can see the 2 compartments here, bony labyrinth and membranous labyrinth. Labyrinth is in 2 parts, bone and membrane. Bony labyrinth is a complex cavity in dense bone, and parts of the bony labyrinth are vestibule, semicircular canals, and cochlea. Here you can see the bony labyrinth made up of bones, and these semicircular canals you can see here. Now this is vestibule structure, you can see here. Openings into vestibule, you can see through this diagram. And semicircular canal, you can see through this diagram. Bony labyrinth, cochlea, cut section. Cochlea, another diagram. Membranous labyrinth, another diagram. Now we try to understand the functions of inner ear. As before, I am repeating again, only gross anatomy is meant for your level. That is why you try to stick to the gross anatomy. Don't go into the minute details. Okay. The functions function of inner ear is to convert mechanical sound waves into neural impulse. Neural impulse means electrical impulse that can be recognized by the brain for hearing and balance. So vestibule is responsible for balance and cochlea is responsible for hearing. Membranous labyrinth, vestibular labyrinth, further details of its structures, Fistra ampullaris. Now we'll try to understand what is balance, means how balance works in your body. Linear balance means in one line. When you walk in one line and you don't lose your balance. And rotatory means when you take a rotation around yourself, after some times if you take round, you try to lose balance. You know that we play during, we have done it during childhood. So there are two types of balance to look here into: linear motion and rotatory motion. And sensory cells which are present in the ear are hair cells. They are called as hair cells, and that is its further structure. Static balance means when you stand head upright, okay, and when you bend head forward, in that case you should not lose balance easily. That becomes a pathology of the vestibular part of your 8th cranial nerve. Dynamic balance means when you walk or when you rotate. Okay. Now, cochlea resembles a snail cells. Snail म्हणजे गोगल गायचं जे सेल असतं ना तशी ती दिसते. And it spirals for about 2-3-4 turns around a bony column. Within the cochlea, there are these 3 canals: scala vestibulis, scala tympani, scala media. See, if you try to remember this well and good. Middle ear is bit easy to remember the words, but internal ear is a bit difficult because you have to remember all these ears. But sometimes if the question is asked for middle ear, you have to at least name the major structures which are present in the internal ear. Now, organ of Corti. Organ of Corti means it is the end organ of hearing. We call it as a what you call receptor, hearing receptor. Like rods and cones are present in the retina for vision. Taste buds are present in the tongue for taste. So those are all receptors. So this receptor of hearing is organ of Corti. Short note padu shakti. Also called as receptor of hearing. And this is the diagram of organ of Corti. If you remember this diagram is well and good, try practice it. Sensory cells of the organ of Corti you can see through this image. Sensory cells, or they are also called as hair cell. Now let us go for a review in short, because after all this is all revision. I would like to have you on mode of your microphones. Which is the nerve of hearing? This is my question to you. Those who know the answer, you can put on your microphone on and answer this question. Which is the nerve of hearing?
Auditory nerve.
Yes, it is always
Auditory.
It is
Auditory.
It is auditory nerve, but you have to call it as a vestibular cochlear nerve in anatomically. Okay, what are the auditory?
Cochlear nerve.
What are the auditory areas? Area number 41, 42.
Temporal lobe.
Area number 42, 41, 42 is a primary auditory area, and area number 20, 21, 22 is a secondary auditory area. I have told it this in the study of brain. Which is the hearing lobe? Hearing lobe. Which is the hearing lobe in the brain?
Temporal.
Temporal lobe.
Temporal lobe.
Temporal lobe is a hearing lobe, and with this, we have completed the revision of anatomy of ear, and today's takeaway home is, of course, the middle ear. And another important structure which can be asked in exams is eardrum. It is also called as tympanic membrane, or anatomically it is mostly called as myringa, sorry, not myringa. From this word, inflammation of the tympanic membrane is called as myringitis. So myringitis is applied anatomy of eardrum. Otitis media is applied anatomy of middle ear. Otitis interna is applied anatomy of internal ear. Okay, so side by side you do this also. And hear and listen to only what is true. जे सत्य आहे तेच ऐका. असत्य आहे ते ऐकू नका. असत्य ऐकू आलं तर ते सत्य आहे की असत्य आहे याचा समज निर्माण करून घ्या तुमचा मेंदूचा, पुऱ्या मेंदूचा वापर करून. ही महत्वाची गोष्ट आहे कानाच्या बाबतीमध्ये. आणि भिंतीला सुद्धा कान असतात. ओके, असू देत, भिंतीला सुद्धा कान असतात, परंतु सत्य बोलायला कोणाच्या बाची भीती नाही आहे. परंतु असत्य मात्र बोलू नये. कोण बोलत असेल तर लगेच त्याच्यावरती विश्वास ठेवू नये. दिस इज अबाउट what you call philosophy from my side to you. Any other question if you want to ask, you can ask me. Yes.
सर एकदा पुन्हा स्लाइड शेअर करता का पहिल्यापासून?
काय म्हणता? पहिल्यापासून. ओके.
Slide show.
Oh yes, you can see the slides from first, and I am telling you again and again, from this you take only the gross anatomy of the ear, every part. Okay, gross anatomy घ्या तुम्ही, बाकी काय घेऊ नका. डिटेल्स तुमच्या लक्षात किती राहतील सांगता येत नाही. Anatomy of the ear, these are the major divisions of the ear, and this is a full ear diagram, all three parts including auditory tube. This is external ear, brief knowledge about functions of outer ear, and this is information about the ear pinna. Ear pinna is also called as auricle. So heart has got auricles. They look like ear pinna, so they are called as auricles. Otherwise, atria is the actual chamber of the heart. So that auricle word which comes in the heart is because of this external ear. It looks like that. External auditory meatus. This is outer ear. Remember about the ceruminous glands or cerumen. This is the middle ear. Middle ear components are very important. Okay. And functions of the middle in short: conduction, protection, transducer, and amplifier. Remember these four words. You can then explain those words in your own language. Tympanic cavity, actual cavity of the middle ear. 6 walls, 1.5 ml is the capacity. Lateral wall is consisting of eardrum. Eardrum is also called as myringa. Tympanic membrane is its common name. And its parts and its layers, another walls, remaining walls of the middle ear. Eustachian tube and ear ossicles, 3 ossicles. Because of their shape, they are called as so in Latin words. The inner ear main parts are 2: cochlea and vestibule. Cochlea in detail and vestibule in detail. That is too much detail. If you have time, you can do that also. But I advise you to keep yourself to stick to the gross anatomy of internal ear. Any one diagram you can remember about this. Main function of inner ear is conversion of mechanical energy into neural impulse, that is electrical energy. These other diagrams. Ear is also meant for balance, so linear motion, rotatory motion, and the hearing is carried by main receptor, and that receptor is the organ of Corti. Organ of Corti is a receptor for hearing, and it will go carry hearing impulse through vestibulocochlear ear, and it takes to the temporal bone for recognition of the sound, whether this sound belongs to Dr. D'Souza or whether this sound belongs to Kishore Kumar or Lata Mangeshkar or a donkey. Thank you, thanks a lot, and have a nice day. Tomorrow it is holiday. On Monday we'll come back with anatomy of eye. Thank you.
Thank you, sir.
Thank you, sir.